You see the word placenta on your ultrasound reports, or you hear your doctor mention it, and we all know that the placenta is also delivered or removed as well during delivery. But do you actually know what the placenta does, where it can be located, and when the position may become a concern? Let's talk about it. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. And in today's video, we will talk about the placenta. The placenta is a temporary organ that develops during pregnancy. It attaches to the wall of the uterus, that is the womb, and it acts as a very important connection between the mother and the baby in the womb. It supplies the baby with oxygen and nutrients. It helps to remove waste products from the baby and also produces important hormones that support the pregnancy. So the placenta is essentially your baby's support system during the pregnancy. Now, when you have an ultrasound, one of the things we look at is where the placenta is located, and there are several normal locations. The placenta can be anterior, which means it is attached to the front wall of the uterus. It can also be posterior, meaning it is attached to the back wall of the uterus, that is the womb. And it can also be fundal, meaning it is located towards the top, or what we call the fundus of the uterus. These descriptions usually tell you where the placenta is attached, and they are all normal. No one is preferable or better than the other. One thing you may notice, however, is that if you have an anterior placenta, you may feel your baby's movements a little later or feel them differently because the placenta is positioned between the baby and the front abdominal wall. But again, whether an anterior placenta, a posterior placenta, or a fundal placenta, they are all normal and very okay. Sometimes during the early stages of pregnancy, a placenta can be low-lying. A low-lying placenta means that the placenta is positioned close to the cervix, particularly the internal cervical opening. However, placenta can appear low earlier in the pregnancy and later be positioned further away from the cervical opening as the uterus grows and changes. So if you are told early in the pregnancy that your placenta is low, it does not automatically mean that it will remain low throughout the pregnancy. This is one reason why your doctor or your sonographer may recommend a follow-up ultrasound later in the pregnancy to reassess the placenta position. But if there are no changes later on, there is another term you may hear called placenta previa. Placenta previa is different from simply having a placenta that is low in the uterus. Placenta previa refers to a placenta covering the internal cervical os. And because the cervix is the passage through which the baby is delivered vaginally, the relationship between the placenta and the cervical opening is very important, particularly later in the pregnancy. Placenta previa can be described as three types. We have complete or total previa. In this case, the placenta completely covers the internal cervical os. We also have partial previa. In this case, the placenta partially covers the internal cervical os. And then we have marginal previa. In this case, the placenta edge reaches the margin of the internal os but does not cover it. In the case of partial or complete placenta previa, the woman may undergo a cesarean delivery. Another thing you may see on your ultrasound report is the placental grading. You may see terms such as grade 0, grade 1, grade 2, or grade 3. These grades describe the ultrasound appearance and the maturation of the placenta. As the pregnancy progresses, the placenta naturally undergoes changes that can be seen on ultrasound, and these changes are described using placenta grades. Please listen to this part. If a pregnant woman experiences trauma, especially blunt abdominal trauma, such as from a traffic road accident, a fall, a significant blow to the abdomen, this can increase the risk of what we call placenta abruption. Placenta abruption or abruptio placenta is when a normally implanted placenta separates prematurely from the uterine wall before delivery. And sometimes, and very importantly, bleeding may not always be obvious. Blood can remain trapped between the placenta and the wall of the uterus. So someone can have an abruption even without any significant vaginal bleeding. This is why significant abdominal trauma during pregnancy warrants medical assessment, particularly if there's abdominal pain, uterine tenderness, contractions, vaginal bleeding, or reduced fetal movements. So what connects the placenta to the baby? The placenta is attached to the uterus, while the umbilical cord connects the placenta to the baby. In a separate video, we will talk about the umbilical cord. So when next you hear the word placenta, the important questions you should ask are, where is the placenta located? How close is it to the cervix? Does it have an expected appearance for the stage of the pregnancy, that's the maturation? And are there any other findings that need follow-up? Because in cases of complete previa, like I said, the mother may require a cesarean delivery, and the maturity of the placenta must match the gestational age of the pregnancy to ensure that the baby continues to get oxygen and nutrients. Remember, the placenta isn't just something that we mention in the report. It is the organ helping to keep your baby supplied with oxygen and nutrients throughout the pregnancy. And it is very important for your baby to remain alive. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and follow for more simple ultrasound explanations that has been simplified for you. And I will see you in my next video.